Hi, my name is Steven. This is going to be our TB skin test. So the first thing I'm going to do is I'm going to check my physician order. I'm going to select a well-lit area for testing. I'm going to gather and prepare all my supplies. I'm going to get my tuberculous syringe, my alcohol wipe, and my 2x2 gauze or cotton swab. I'll make sure I read the vial as it's removed from the refrigerator. I'll inspect the vial for the expiration date, the date that the vial was open. If it is a new vial, I'll make sure to write the date and the initials on the label. I'm going to perform hand hygiene, and I'm ready to enter the patient's room. Knock, knock, knock. Hey, good morning. My name is Steven. I'm going to be your nurse today. Today we're going to be administering a TB skin test. Can you verify your name and date of birth? Perfect. Do you have any allergies? Are you in any pain right now? No? Excellent. So it should only take about 5-10 minutes or so to have the test done. After that, we'll go ahead and get started. All right. After I determine the patient's name and date of birth, their allergies, and stuff like that, then I'm going to also determine the patient's tuberculous skin history. So my patient is afraid of needles, and so that means that I'm going to take extra time with that patient, making sure to explain it completely to them, let them know the size of the needle, that it is a very small needle, that it is going just directly under the skin, so it's not going deep, and just taking my time with that patient. My patient did have an MMR placed the day before, so yesterday, on 7/1, she had an MMR vaccine placed. And then we're going to go ahead and place her TB test today on 7/2. All right, so now I'm going to provide patient education. I'm going to perform hand hygiene, and then I'm going to position the patient's arm correctly, and I'm going to choose the correct injection site, which will be the inner side of the forearm. And then I'm going to go ahead and apply my gloves. Alright, so I'm going to cleanse the proposed injection site, surrounding it with the aseptic swab in a circular motion, starting at the site and working outwards in several inches. I'm going to let that dry completely. Then next I'm going to have a new swab and clean the top of the vial, let that dry completely. I'm going to secure the needle tightly on the syringe, making sure that it's completely on the syringe. I'm going to inject air into the empty part of the vial. So air's in. Then I'm going to withdraw the correct amount, which will be 0.1. I'm going to gently tap the syringe to remove any air bubbles that are in here. And then I'm going to expel all air from the syringe and the excess fluid, so that I'm sitting at 0.1. Perfect. All right, so next. All right, so now I'm going to stretch the skin taut, and I will insert the needle at a proper angle for the intradermal injection. All right, inserting it in. All right, now I'm going to inject the tuberculin solution, forming a wheel to 6 to 10 milliliters. 6 to 10 millimeters. I'll remove the needle, and without massaging or pressing the area, I'm going to activate the safety device on this needle, if applicable, and discard the used syringe in a sharps container. So we'll go into it. All right, if minor bleeding occurs, then I'm going to dab it very gently with a cotton ball, a dry gauze pad, or I'm going to do a swab. Next, I will go ahead and remove my gloves, put those in the trash, perform hand hygiene. I'm going to record the date, the time, the injection site, the name of the manufacturer, the lot number, the expiration date of the PPD solution, and the student initial, or the nurse's initial. I'll instruct the patient on the care for the injection site and explain normal reaction to the skin test. I'll also inform the patient about the importance of returning 48 to 72 hours to have the test read and given written appointment card with the date to return. All right, so now this is for the reading of the TB skin test. It is now 7:04, so it is within the 48 to 72 hour window for this patient to have it read. So the first thing I'm gonna do is I'm gonna gather my supplies. So the only thing I will need is a millimeter ruler to determine the size of the induration. So first I'm just gonna go ahead and perform AIDIT. Knock. Hey, good morning. My name is Steven. We're going to be reading your TB skin test today. Should only take about 1 to 2 minutes just to read the test. It does not take long. And I will just rub my fingers over your skin to be able to actually determine the induration and measure over the ruler if I do feel anything. And let me get everything together. And I'm going to go ahead and check your name. Perfect. Date of birth. Excellent. Do you have any allergies? Are you in any pain? Excellent. All right. So now I'm going to go ahead and perform hand hygiene. I've already explained to the patient how I'm going to read the test by rubbing my fingers across the skin, feeling for any induration on their skin. All right. So I'm going to inspect the patient's arm in a well-lit area on a firm surface. I'm going to locate the site of the injection on the patient in all 4 directions to locate the induration. So, making sure I'm checking all around where the injection site was. Then I'm going to swipe the fingers in a 2-inch diameter from the injection site in all 4 directions, like I said. Using a zigzag, feather-like touch to palpate the induration margins. All right. I'm going to repeat the palpation until the patient's arm raised at a 45 degree angle. Then I'm going to move my fingertips toward the injection site without lifting. So making sure 45-degree angle, making sure I go toward that injection site. Next, I'm going to use a ballpoint pen to mark the widest edges of the induration from the thumb to the pinky finger with a fine dot. My patient does not have an induration, it has a 0 millimeter induration. If it did, I would use the millimeter ruler to be able to help determine the size of that. So I'll locate the induration on margin on the other side of the patient's forearm and place the second mark on the margin of the induration. After that, I'm going to palpate again, repeat the finger movement toward the injection site, and adjust the dots if necessary. Measured only the induration, not erythema, making sure that I am only doing that induration. Then I'm going to place the 0 ruler line inside the left dot edge, read the ruler line, and inside the right dot edge. All right, so next, after I've already read the millimeters or the induration, I'm going to correctly record the exact measurements in millimeters of the induration on the Manitowoc tuberculin skin test record form. I'm going to record the date, the time, that it was read. I'm going to put my initials, my name and my signature in the presence of the presence or absence of adverse reactions, blistering, redness, and swelling. I'm going to explain the significance of a positive or negative skin test to the patient. I'm going to direct the patient to follow up if necessary. I'm going to provide documentation, copy of the Manitowoc tuberculin skin test record form to the patient and explain the importance of retaining this information. And then provide culturally and linguistically appropriate educational material to the patient. Lastly, I'll just thank my patient and I'm all done.